Today's guest, thought it's very important to talk about our mental health, is Kim Willis. She's the Director, Communications and Mental Health Promotion at the Canadian Mental Health Association. Kim, good morning. How are you?
Good morning. I'm doing okay. How are you?
We're all hanging in there, aren't we?
Yeah.
I guess firstly, how are you doing? How's your family doing through all this?
We're doing okay. We actually were away when all of this hit, that all of the physical distancing and social isolation. So we were on a vacation, so we are almost done with our 14-day self-isolation. So we've survived that. So looking forward to that being over. But yeah, we're doing okay.
Excellent. Yeah, it's a difficult time for everyone, especially
sure.
people that have been traveling.
Yeah.
Tell me, how has COVID-19 affected the Canadian Mental Health Association?
Well, we are an essential service, so we are continuing to serve our clients to the best of our ability. What that has meant is all of our groups, of course, have been canceled. And our frontline workers are using the phone more than ever to connect and support our clients that are in need, of course, during this time. And we also have a health center that's part of our branch. So they continue to see those clients by appointment and take the necessary precautions with the PPE and the protocols and the screenings that are necessary. But essentially, we don't want any visitors coming into the building that aren't deemed necessary at this time.
There's a lot of talk about social distancing. It's really important now. Tell us about social distancing and the importance of having a social connection.
Yeah, and so that's really what we've been focused on for my team over the last week or so, is that we know physical distancing is so important. We all have to do our part to flatten the curve. But as human beings, social interaction and connection is so important for our overall mental state and our mental well-being. So we are encouraging people to keep connected. We actually launched a campaign yesterday that we're hoping on social media, using that hashtag, people can show some of the ways that they are continuing with those social connections and social interactions. So it can be as easy as doing a class online for fitness, or doing some group chats, or some Zoom parties with your friends. But there's lots of creative ways that people are going out of their way and to keep connected.
Now, with all the schools closed and the daycares closed, families are being in their houses with their children. How do you talk to your kids about COVID-19?
Yeah, I mean, I think our philosophy is always to be honest. You don't want to scare them with all of the facts based on the age of the child, but they're certainly living this reality. And I think it's important that on a simplistic level, we break it down and share what's happening and why it's important to be washing our hands constantly, and why it is that we're having to stay away from our friends and loved ones. And but I think honesty is important, and not hiding what we're going through right now.
Yeah, it's a very stressful time, and I'm sure depression will probably set in also. What initiatives do CMHA have in place, or any resources that the public may want to take advantage of?
Sure. So we are actually offering a lot of free online webinars right now. So for those dealing with stress and anxiety and COVID stress and social isolation. So we're trying to highlight all of those hot topics right now. And again, with our Keep Connected campaign, just showing ways that people can be active and doing what they can to, if you are feeling depressed, things you can be doing to help yourself. And I mean, even the people that are the most mentally fit and the most mentally well, this is a lot. We're used to being social creatures, and it's easy for the best of us to have those moments of depression and negativity. So, I mean, the webinars are one tool that we can use. And I also think, social media can be a good thing and a bad thing. but certainly going on to our CMHA channels, we're trying to highlight the positive and different tools and outlets for sharing your thoughts or just staying connected.
Well, let's share some of those. Your website,
Yeah.
the webinar, phone number,
Yeah.
anything you want to.
Yeah, so windsoressex.cmha.ca is our website, and we have a page dedicated to the Keep Connected campaign, so certainly that's a great resource. All of our social media handles are CMHAWECB, so check those out. And on all of those channels is where you can find information to get onto those webinars, as well as on our website.
Well, thanks, Kim. Thanks for the information. Thanks for being there for our community. We really appreciate that.
Yes.
And just stay well and stay safe.
Yeah, we're in this together. And just one more number. If you are in crisis, the number is 519-973-4435. So if you are in that state or feel like you really need to access a crisis worker, please call that number.
Excellent. Thanks, Kim. Really appreciate it.
Thank you.
And that's your TV COVID update for today. We'll be back again tomorrow. Remember that we're on at 12 p.m., 5 p.m., and 10 p.m. Stay well and stay safe.